a very generous introduction. I think I would just like to add a few things. Rest of the things we are going to discuss. You are here to become an orthopedic surgeon or what? You are appearing for an orthopedic. Just give answer. You want to become an orthopedic surgeon? No, I want you to become a thinking orthopedic surgeon. Everyone will become orthopedic surgeon, but excellence will come if someone is a thinking orthopedic surgeon. One case, one procedure, one outcome is one. The similar second case, second outcome is altogether different. And you should, if you are a thinking orthopedic surgeon, you will be able to differentiate between the two and the many such cases. So, keep your objective to become a thinking orthopedic surgeon. I'm sure it will start with becoming an orthopedic surgeon, and then, so you read first whatever is written, and you reply whatever is written, you see whatever is shown, you tell whatever is elicited. But then in due course of time, you start reading between the lines. You start differentiating between two similar patients, and that is a thinking orthopedic surgeon. So have your objective of becoming a thinking orthopedic surgeon, and then that's the first step where you are. And we are all here to help you out in that. Second thing, you can never extract anything from anyone unless you are humble. You can take knowledge, you can take only thing if you are humble. So, and who gives the knowledge? No, it's not always teacher. It's your colleague. In your life, you will get knowledge from many people. You will get now from your teachers, from your books, but from your colleagues, and more important, from your own patients. So, be empathetic, be soft, be polite with your patient, and patient will tell you 10 new things of his problem, then you will be able to make a quick diagnosis. So in a way, just being humble, it is making you competent enough to make a good diagnosis. So for your own benefit also, fine, because we are healers. We are not, we are just not treating patients. We are healer. And healing has an emotional quotient as well. So if we are soft, if we are empathetic to the patients, if we talk well to the patients, I'm sure his emotional quotient also will add to the outcome, that is the healing. So we pledge today that we become a thinking orthopedic surgeon and a good healer. All the best.